A growing concern over skincare trends that are not safe for the tweens. Joining us now, Dr. Shafu, with how you can keep your child safe. Dr. Shafu, I have a lot of friends who have the girls in this age, and I hear that all they do is stay at Sephora and all these different places, and they just do skincare. And these are very young kids putting these products on their faces.
And that's a real health concern, Jolla. You know, as parents, we all have, children in this age group. The problem is that they're really influenced by a lot of these social media posts that are put on by these influencers, obviously, that are financially driven. And the most important thing, I think, the take-home message for the public is that we need to understand that these products that you've just mentioned are really not for the young skin, because we need to understand that our skin is a very delicate ecosystem. It's really the way that we protect ourselves from the environment. It regulates our metabolism for temperature, for moisture, and keeps bacteria away. And so these products, Jolla, are really meant for skin that's more aged. So skin 30 and above, when there's been a lot of sun damage, there's wrinkles and lines. Yes, those products are very helpful and very effective, but the problem, the flip side is that when they're used in very young skin, they can damage the protective layer of the skin. And dermatologists will frequently see, young girls coming in, well, they'll have rashes and they'll have breakouts that they really weren't having before they were using these products, because the skin isn't designed to use those products or be exposed at that young age.
But let's talk about the skin of the tweens, because I remember when I was a teenager, I struggled at times with those breakouts. So you go to try to solve this in that teenage year that your skin and everything.
Of course, it's
so
very
important.
So important.
So what should those teens be looking for if you're looking for something to help with the blemishes?
So I think the most important thing is to understand that the skin does have blemishes and does have pores and doesn't have that ground glass appearance that they'll see photoshopped on these social media. And so to understand that the skin has a dynamic effect.
Okay.
And certainly if there are changes, such as, for example, with acne breakouts, that's really the time to get in to see a dermatologist, right? Because if you're using some of these skincare products too frequently, or the wrong products, you can make those skin problems worse. You can actually make acne worse.
Did you hear that?
You can get outbreaks with eczema, psoriasis, and these are literally kids that will come in, Jolla, have had no skin problems, and now they have rashes, the skin is itching and scaling, and then it becomes a vicious cycle, because the theory is, well, gee, I'm just not applying enough of a product, or I'm not applying enough products,
right.
So it can be really a snowball-like effect.
So for this age group, this tweens, what is the appropriate skincare regimen for them? So
the most important thing, like we've talked about on the show so many times before, is sun protection, sunscreen. So when you're in your 30s, you're less likely to necessarily need these products.
Right.
If you're going to use anything on the skin, it needs to be very gentle. This is baby soft, smooth skin. So you want something, if you're going to use any kind of a cleanser, make it something mild, simple, and inexpensive, like a Cetaphil-like product. And apply a small amount beforehand, making sure you don't have a reaction to it. Using a broad-based sunscreen, as we've talked about before, an SPF of 30. And if you're going to use a moisturizer, again, use something very mild, very gentle at the end of the evening.
You're a parent, and I know the parents watching right now going, come on, Jolla, this is a lot harder to do.
No, it's totally hard.
We all get
exactly, and as parents, the tendency is to, well, this is what we're going to do.
Yes.
But I think the most important thing, Jolla, is to have a conversation with your child, to let them open up about, well, what is it that's driving this? Are they seeing something on social media? Is somebody saying something? Because as we know at this age, unfortunately, social media can have a very deleterious effect on someone's self-image, which at this point is still developing.
Yes.
So it's high risk of anxiety and depression. And it's just creating unrealistic expectations. These social media influencers don't have this ground glass appearance to their skin. Skin is not porcelain-like, and it's not free of blemishes, and nor pores. So I think it's important, once as parents we open up and allow them to tell us what they're feeling, then we can back that up with science. Well, what are the actual facts? What's really going on? And then directing them to use safe products. And certainly if they're having a problem with their skin long term, to turn to a dermatologist and not a beauty industry company or a social media influencer.
Yeah. All really good advice. Let's see if it works. Dr. Shepard.
Fingers crossed.
Thank you. We're going to take a short break. We'll be right back.